Well, thank you everyone for making time to join today's live. My name is Dr. Natifa, and my co host here is
George.
he's a clinical psychologist, and I am a medical doctor. Today, we'll be discussing or be talking about tuberculosis, um, the impact on your physical and on your mental health. Yeah. I think this month is tuberculosis. This month is actually tuberculosis awareness month, and we just like to discuss how tuberculosis is transmitted, how do you know you have it, and what to do once you think you have it. So yeah, we'll just dive into it. So tuberculosis is usually caused by a bacteria called Mycobacteria tuberculosis. There's this myth or there's this thing that people thinks it only affects the lungs. No, that's not the case. Tuberculosis can actually affect any part of the body except the nails and the hair. I find that very interesting. Yeah. So any part of the body, it can affect your brain and cause meningitis. It can affect your spine and cause TB spine, can affect your liver, your kidneys, literally every organ except your nails and hair. Those are the only organs that are spared when it comes to tuberculosis. And how does one get it? Usually, transmission is through droplets. It's interesting that this bacteria is very small, that it can be suspended in air. So, transmission is usually through aerosol or droplets. So, as we're speaking here, if I have TB, George, you're at risk of getting because we're in close contact. Yeah. So, that's how it's transmitted. And once it's transmitted, usually the human body can you have defense mechanisms that can clear it out. You're able to your white cells, your defense mechanisms can be able to fight it and clear it out unless one is immunocompromised. If you're immunocompromised, it becomes a problem in clearing this infection out. So yeah, transmission is through droplets, and it can literally affect any part of your body, not just the lungs. The most common organ or the first organ to be affected is usually the lungs, because once you get into contact with these droplets, they go to the lungs. And in the lungs, the main part that's affected is actually the upper part of the lungs. It's called the apical part or the apex, because that's where there's more oxygen. Yeah, because this is an aerobe, it likes oxygen. TB actually likes oxygen. So once it goes to the lungs, your body, if you're immunocompetent, you'll be able to fight it out and clear it from the body. If you're immunocompromised, then it becomes a problem, and then you can transmit it to other people. And it's interesting, according to WHO, people think that TB has been eradicated. That's also not the case. There's a lot of myths we're going to debunk here today, George. People think TB is a disease of the past. No, it's still with us. And do you know how many people are affected with TB as we speak? Out of the 7 billion, sorry, what did you say?
You're saying worldwide.
Yeah, worldwide. How many people do you think are affected by TB?
If my guess is right, is around 10.7 million in 2024.
It's actually more.
Okay.
So, according to WHO, World Health Organization, the people living with TB currently is 2 billion. 2 billion people have TB. But just a disclaimer is that we have active TB and we have latent TB. Latent TB is basically you cannot transmit it to other people. You've contained it within your body. Active TB, you can transmit it from one person to another. And in 2021, there was 1.6 million deaths from tuberculosis. So this disease is highly contagious, highly infectious, and it actually causes a high mortality rate. Like the number of deaths caused by this tuberculosis is very high. 1.6 is still a lot. So those are the statistics for tuberculosis. And the reason why we're doing this live is just to create awareness, to make people take better care of themselves. Like if you feel like you're feeling some type of way from the symptoms you're going to discuss, please feel free to call us just to be reassured if you're okay or if you're not okay. Yeah.
Give the Kenya statistics. As 2020,
Okay. You can give that according to Kenya. Yeah.
90,000 people were diagnosed with TB.
90,000 people. So this is just in Kenya. And then there's almost with people living with HIV. So that's a huge, huge number. So there's still a high burden of this tuberculosis disease. We've already discussed how it's transmitted. Who is at risk of getting TB? I know many people are asking, oh, am I at risk if there are droplets out there? Will I get the TB? So people who are at risk of TB are, one, people who live in poorly ventilated areas, areas where there's a lot of people. Yeah, so in the slums, yeah, there's congestion. So in prisons, yeah, all that can cause, like, your physical location can make you be at risk of getting TB. Also, like if you're using public transport, all the windows are cold. It's now, we're in April, coming April, it's cold. No one wants the cold, all the windows are closed. That can predispose you to getting TB. So it's important to like open the windows, be in an area where, if you can, is well ventilated. That can really protect you from getting infected. The other thing that can put you at risk if you're immunocompromised. So people with HIV are at a higher risk compared to somebody who does not have HIV. So yeah, and then the other group that's also immunocompromised are young children, less than 5. They're also at a higher risk of getting TB because they're still building their immune system. They're not able to like clear it out. And also people who have had organ transplant, people who have cancers, they're also immunocompromised in some ways. So those are people who are at risk. Also, people who use IV drug use, they're also at a higher risk of getting tuberculosis. What symptoms do you think one would have if they have TB?
Yeah, there's weakness. One, the commonest we see is coughing.
Coughing.
Yes.
Yeah.
And then emaciating of the body.
Weight loss.
Yeah, weight loss.
Okay. So yeah, at the initial stage of getting TB, the most common organ that's affected is the lungs. But as we've said, it can literally affect any part of your body. So depending with what part of the body is affected, that's how you'll present. So if it's the lungs that are affected, you end up with TB pneumonia. The most common presentation is persistent cough. Please don't ignore these coughs. Don't think that, oh, maybe it's flu, maybe it's an allergic cough. No, 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 no. Not all coughs are the same. The TB has a persistent cough of more than 2 weeks associated with weight loss, night sweats, yeah, drenching night sweats. You wake up and you've drenched the whole bed. So those are the common symptoms that people usually present. If it comes as meningitis, of course you'll present with symptoms that are suggestive of meningitis, things like severe headache, photophobia, you don't want to see any lights, vomiting, convulsions, yeah. If it presents as TB spine, you can have chronic lower back pain with weight loss and night sweats. So it can literally affect any organ, and the organ that's affected, that's how you're going to present symptomatically. So once you call a doctor or once you go to the hospital, there's usually like a series of tests we can do to like confirm the diagnosis of TB. The most common one that's commonly used and everyone knows it is chest X-ray. They do imaging of your chest. It's usually like pretty straightforward. There are other more confirmatory tests like sputum. So you can use your sputum to do a culture, and we're able to culture the Mycobacterium tuberculosis. Other tests, but are usually like for screening, are the skin test, Mantoux TB skin test, but that's usually for screening. So the most important test that we usually do is gene expert, sputum, and also like chest X-ray, so that you're able to like diagnose TB. So once a person has been diagnosed with TB, I think this is very, very important, and I think it's going to be part of what you're going to discuss is when it comes to treatment for TB usually takes a while. It's not something that you take medication for like 5 days and it's done. No. So depending with what part of what part of the body is affected. Let's say, for example, if you have TB of the lungs, tuberculosis of the lungs, the treatment regimen for TB of the lungs usually takes like around 6 months. So that's a long time. And in certain organs, it can even take up to a year. And in areas where you have drug resistant TB, it's also like a whole other issue. I think at this point, I'd like to invite you, George, to just discuss what are the like mental, or what are the impact of TB on your mental, not just physical.
Okay, thank you, Dr. Nadifa. As you rightly mentioned, out of The commonest that we're seeing around our community is what we call the pulmonary TB. That's of the lungs. So one of the mental issues that comes with that is we experience anxiety because there's that fear of when I go out, I will be isolated. When I meet with people, people will isolate me. People don't want to be closer to me. It brings a lot of isolation. So it comes with anxiety all most of the time. When you look at the number of deaths you've mentioned, around 1.2 million people dying. A number of that is out of non-adherence to drugs. Means they didn't because it takes a while. 4 months if you're taking drugs means and non-adherence comes as a result of this individual has developed some mental health issues. Maybe the individual has developed depression because he's taking this drug to an extent he's getting tired. He's feeling that maybe he's gonna die or in very soon. So that's when you experience depression means you stop adhering to drugs. And now the end effect of this is means if you stop adhering to these particular drugs, then you develop to the MDR, the multi resistance. Yes. So now that now takes a longer period for you to now to get treated. Because one thing we mentioned, TB is treatable, right? It's curable, which is quite okay. So stigma associated with TB is another major psychological problem that comes in. Because when we get TB, people think that I'm gonna die immediately, but that's a myth. It's not the truth. If you adhere to treatment the way it is, then chances of you recovering, being cured, are very high. So in order to reduce those particular stigma, this is where now your mental health becomes of major importance. We've mentioned that its treatment period takes long. So means the financial implication also comes in. Yes. But now where it's coming in, if you are the father taking care of the family, now you are perhaps hospitalized. You're unable to go to work. So there's no one else to support the family. And now then you get depressed out of that. You see your children are suffering, everybody's suffering around you. And then now it's, yes. So it becomes the entire family now become affected with this. Thirdly, other things that we need to consider is because TB is infectious, if one senior member has it in the family, is not if that person is not take care of the family, means the entire family is likely to get it, and that begins another cost on that particular family. Yes, so you find the entire family is now affected, and that brings a lot of mental issues. You get depressed, the family gets strained out of all what is happening in all those things. Just the physical outlook. When you lose weight, people used to see this and see another difference in weight brings a lot of mood disorders. You feel get low moods out of how people perceive you. So keenly is where now you require a lot of support, psychological support. At the initial stages of when you're taking a treatment with TB, a lot of psychological first aid comes in, where you are supported in terms of to do those things. You are supported in terms of being adherence to the drugs, and you come to learn, given a lot of psychoeducation on what is TB. We get a real awareness of what TB is and the treatment plan that is there for TB. So when you adhere to this, then it gives you a good chance for recovery.
That's very interesting, George. Actually, like I hadn't even thought of the cost implication of how TB can actually affect the entire ecosystem, not just in terms of the family, also like in terms of revenue that the country makes. All this, it's actually the impact of TB is beyond an individual. It's not just within the family. So it's important that these people actually, as you've said, psychological first aid once they're diagnosed is very important. So I think there's a lot of emphasis when you go to hospitals where they make sure the patient has they've been diagnosed and they've started treatment, but now adherence to treatment is a whole issue. I know there is DOT, I don't know if you've heard about it, direct observation treatment, where somebody like either a medical practitioner or a family member who's trained, like they actually observe you as you take the medication. So there's direct observation to just to make sure you are adherent to the treatment. Because once you're not adherent, as you've rightfully said, it can lead to multi-drug resistance, which is a whole other issue. So I think my I would just like to repeat, TB is still here with us. It's not yet eradicated. It's highly curable. It's treatable. It's just that the treatment takes longer. But once you're diagnosed, it's very important to get like a support system. Yeah, which is very important. A support system can be through a friend, can be through a psychologist. Yeah, any person who you trust, who you can confide in this, so that you're not isolated. Because once you're isolated, it's like a ripple effect. Yeah, so your physical, your mental, and then eventually like you feel like you're not productive, you're unable to make ends meet. It becomes a whole issue. So I think that's very important, highlighting this. So TB is still with us. 2 billion people are still affected with TB. They have latent TB, which is not active, it cannot be transmitted. So it's something that's still there, and we shouldn't really ignore. There should be more of this, like health education, like educating the public. Like they shouldn't just ignore the cost that they're having. They shouldn't ignore how they're feeling. That drastic weight loss is not normal. Get it checked. I think it's important. Like we do more of this just to like inform and educate the public on these matters. I don't know if there are any questions from our viewers. So one of the questions, George, can you take that? She asked, one of the viewers asked, when should you be worried? When should you be worried when you have a cough? Yeah, that's the question. I think the most important thing with TB is that it's persistent cough of more than 2 weeks. Yeah, if you're coughing for more than 2 weeks, you're having associated night sweats, you're having weight loss, and TB is very drastic in its progression. So if you're seeing these symptoms, you're having loss of appetite, you're not. That's when you should seek healthcare. But if you have flu, it's been there for 3 days and it has cleared, that's fine. If you have history of asthma, you're on inhalers, it's good just to get the clearance from the doctor, but don't ignore the cough. But the most important thing with cough for TB is that it's persistent cough of more than 2 weeks. Yeah. Ah, okay. Are there symptoms that one can overlook that could be like TB? And what are these symptoms? Sometimes TB, as I've mentioned, it can be very non-specific. So when you're talking about the lungs, at least that one it's more localized. You're able to like diagnose it: cough, weight loss, night sweats. It's very pretty straightforward. But if it has affected TB of the intestines, you're just having altered bowel movements. That means sometimes you're constipated, sometimes you have diarrhea because of the granulomas that are forming, or masses that are forming within your intestine. You're having weight loss, very non-specific symptoms when it comes to these other organs. Yeah. If you're having TB of the kidneys, how would you know? Vague pain in the abdomen, flank pain. Yeah. Or maybe you're having urinary changes, fevers that are like they're coming and going. So TB can be very unspecific sometimes if it's not the lungs that's affected, because once it affects the lungs, it can spread to the other organs. So just be on the lookout. Don't ignore any symptom that you feel like should be checked out, because it can be very vague. As I've said, it affects all organs except for the hair and the nails. So any other organ, if you're having bloating, if you're having, just get it checked out. Yeah. I think TB is TB. I don't think it has. So it can be active or latent. Active is that it's contagious. You can transmit it from one person to another. Latent is basically inactive TB. Inactive, it's dormant. Yeah, it's passive. You cannot transmit it from one person to another. It's contained. Yeah, I think that's the clear distinction. But really, there's no stages when you say like this is stage one TB. No, there's nothing like stage one, stage two, stage three. No, it's just either active or latent, and it can affect multiple organs. Um, yeah, I think this I can give it to George. George, how can a family support one that has been diagnosed with TB?
Okay, thank you for that. So, one, as you had mentioned, TB is contagious. It means one support system is very important. Means you have to be there for that particular individual, and maybe I put an emphasis. Once somebody has been diagnosed with TB, I think it is important this person to know the journey they're going to take, so that to help them to adhere to that drugs. Sometimes you can go to the hospital and then you're given drugs expecting to have changes in a few weeks, of which maybe you'll experience some changes within a month. You find yourself gaining weight and you feel you're not coughing anymore. Then you feel, okay, I'm doing well. Then you stop taking drugs. That would be a problem because it will result to non-resistance of the other treatment. So the family member should be there to make sure to help this person to adhere to the drug taking. And the family members need to understand the journey you're taking with this particular individual. If he was a provider, means the provision might get challenged in one or the other. Another, additionally, this is TB comes out of those particles. So if you're sharing items, if you're sharing particular foods, cleaning has to be taken into consideration. So you cannot be sharing spoons. That's the normal way. You use this spoon and then you don't clean it very well. Then another person uses it. Chances of it spreading it within the family becomes high. So family members must be there for that particular individuals to make sure that we contain TB in itself.
So in the early stages, once you're starting treatment, it's highly contagious. So usually isolation would be a strong word. I think quarantine is a better way to put it, where people who are attending to this patient who has TB, maybe they're wearing protective gear, an N95 mask because it needs to cover your up to the level so that the droplets don't get in because they're tiny, they can get in. But isolating a person completely is not really recommended. We're all human beings, we're all social beings, like we need that human interaction. Yeah, so I think just putting in the necessary measures here, yeah, but not isolating a person completely. Do you want to take that? I think I can just try and then you give from a psychological point of view. I think the stigma comes because it's a disease that's usually associated with people who are immunocompromised. So once people hear TB, they think, hey, you must have some sort of immunocompromised condition like HIV. So there's a lot of stigma because of the conditions associated with it. That's usually not the case. You can be somebody who has TB without HIV. Doesn't mean that if you have HIV now you deserve the stigma. No, but I think that's where it stems from. I think that's where, like, from long back, like before then, I think that's where it stems from. But maybe you can just give your point of view.
Additionally, is in terms of the patients, how they present, the physical presentation of that. When you begin losing weight, and so losing weight still goes what Dr. Nadifa says is associated with immunocompromised diseases. So means when they see you lose weight, what does it mean? You could be having the other disease. And additionally, when you're losing weight, what do people associate with that? So that's why the stigma becomes so high on that. And then additional other things when you're coughing persistently, coughing. So people tend to stay away from you to avoid you, and that where stigma comes in.
when okay. So I think mental health support shouldn't just be when you're feeling down. This is like a personal opinion, and maybe it's an expert opinion from George. I think mental health can be a form of gym, but for your brain, for your mind. Yeah. But I think at what point? Okay, now I get the question. At what point in your journey when you've been diagnosed with TB? At any point. If you've been diagnosed at the beginning, that's the best time to start. because you really need a lot of support. And the person who would mostly understand you with no judgment, the best person would be a psychologist. Yeah. So I think that's my point of view. At the point where you've been diagnosed and you're starting treatment, as you're starting to take the tablets for the TB, the TB regimen, I think you can also start the mental health support. Yeah. Oh yeah, that's actually I haven't mentioned that. Prevention for TB, like at birth, we're all given the BCG vaccine. There's a vaccine, there's a provision for vaccination for prevention of TB. What that means is that once you get the vaccine, your body has memory in case you're exposed to the TB again, you're able to fight it off. So vaccinations are there. BCG vaccine is readily available. It's usually given if you're born in Kenya or in these third world countries. I think it's a requirement that you're given at birth. Yeah, we all have that scar here on our left arm. So there's provision for vaccination and also like proper ventilation, like the basic hygiene practices that can help prevent transmission. Yeah. I think my parting shot is TB is highly curable. And I think when diagnosed early, the outcomes are even better. And don't just ignore that cough. Don't ignore any cough. If you feel unwell, if you feel tired, if you feel like you're bloated, please don't ignore those symptoms. They could be pointing to something bigger. Yeah.
My parting shot is TB is here with us. Get awareness on TB, what it is, and having knowledge on TB will help you to overcome TB. Thank you.
Thanks, George. Thank you all for making time to join today's live. We usually have this live every Thursday from 1 to 2 p.m. Yeah, you're most welcome to join the next session. Thank you so much.